should I feel the way I do? It's only love and that is all. But it's so...
Hi everyone, today's video is going to be about what questions to ask when you're searching for a skilled and experienced TMJ dentist. It can be incredibly difficult to find a TMJ dentist with a lot of experience, with compassion, with empathy. It shouldn't be so difficult, but it often is. For those of you who don't know me, my name is Priya Mistry, and I'm a general dentist with a practice in Vancouver, Washington, where we're dedicated to taking care of those with TMJ disorders. So let's get right into it. These are some questions I would ask if I was looking for a TMJ dentist. I will list off each question individually, and then I'll circle back around and go over it. Number 1, how long have you been treating TMD? Number 2, how do you treat TMD? Number 3, how do you define success in treating TMD, and what is your success rate? Number 4, what is your experience level and success rate with treating disc displacement without reduction? Number 5, how many visits are included with treatment? Number 6, are follow-up visits with the dentist or with the dental assistant? And last but not least, number 7, how do you take payment, and do you offer payment plans? Before going over each question in detail, I do want to take a moment to stress the importance of finding a TMJ dentist who listens when you speak, one who shows empathy, sympathy, and compassion. If you find someone like that, you'll trust that they will do whatever they can to help you feel better. This is so important because TMD can be truly debilitating. All right, question number 1. How long have you been treating TMD? This question is important because to treat TMD effectively, experience is needed, in my opinion. My mentor, Dr. Arthur Parker, trained me for 3 years in taking care of those with TMJ, TMD. In those 3 years, I saw it all. I saw people whose pain was coming only from the muscles. I saw people whose pain was coming only from the joints. I saw people with some combination of the two. I saw people whose jaws were locked closed. I really saw it all and every combination. And in that time, if I had a question, if I was uncertain, I had a mentor who had been treating TMD for over 30 years. So I could easily ask him and learn more with each and every experience. Seeing the variety of ways that TMD can present and treating each individual specific condition is vital when it comes to treating TMD. I cannot stress this enough. Many dentists have websites where they say that they treat TMD, but they actually have little to no experience at all. So try to find someone with at least 3 to 5 years of experience treating TMD. Question number 2, how do you treat TMD? The answer to this question will give you some idea of how the practitioner you're speaking to treats TMD. Some treat with oral appliances. Some treat with injections. Some TMD practitioners treat with some combination of the two. And there are others who treat with totally different modalities from what I just mentioned. My treatment involves TMJ orthotics, TENS therapy. TENS stands for transcutaneous electrical nerve stimulation. For more information on that, watch my video on it, which I've linked above and below. So again, my treatment is with TMJ orthotics, TENS therapy, and lots of hands-on manual therapy, working with the soft tissue, the muscles, and the fascia. Having an idea of how the TMD practitioner that you're working with treats TMD is important in helping you make the best decision for your treatment. You'll notice that as you do more research, as you meet more TMJ dentists, that no 2 TMJ dentists work the exact same way. Question number 3, how do you define success in TMD treatment, and what is your success rate? Success can be a relative term, so it's important to define this before moving forward, before making your decision on who to work with. At my practice, success means a healthy jaw range of motion, drastically decreased or eliminated joint noises, no more incidents of jaw locking, and drastically decreased or eliminated headaches, ear pain, stuffy ears, neck pain, tooth pain, etc. For my patients, 90 to 100% of their symptoms are eliminated. I always say my success rate is 90%, but it's actually higher, especially with disc displacement without reduction or jaw locked closed. Just hearing the answer to this question will give you a good idea as to your dentist's success rate and if they can be able to help you with your specific symptoms. Question number 4. What is your experience level and success rate in treating disc displacement without reduction? This question is very, very specific. The reason for this is because, in my humble opinion, disc displacement without reduction is the most difficult jaw condition to treat. This is informally called jaw locked closed. This is a condition where you can barely open more than 1 or 2 finger widths, and there's a lot of pain typically associated with this condition. If you want more information about this specific condition, watch my video, Disc Displacement Without Reduction. I've linked it above and below. If the dentist you're speaking with has had experience and success with treating this condition, then it's highly likely that they can help you with what you're experiencing. Having said that, I've only met a handful, probably less than 5 practitioners across the nation that can treat this successfully. That is why I'm very, very hesitant to make referrals. Many of you will message me asking, is there someone that does what you do in this state or in this city or in this county or in this country even? And I'm very hesitant to make referrals because I just don't know that many people that can treat this condition. And if they can't treat this condition, I cannot guarantee you that they can help you. Like I said before, it's so hard to find a TMJ dentist with experience, with skill, with compassion, with empathy. These are all things that you want in someone who's helping you take care of this TMD condition, which can be truly debilitating. Question number 5. How many visits are included with treatment? This question is important because it can help you calculate the true cost of treatment. For example, and these are not my fees or my numbers, some TMJ dentists will charge $7,500 for a TMJ orthotic and 1 or 2 follow-ups. Another TMJ dentist may charge that exact same amount for the orthotic and 15 follow-ups. See what I mean? That's a totally different cost of treatment, and you get more bang for your buck with one than the other. So again, these numbers are not my fees. Keep that in mind. I was only using those numbers for example purposes. Question number 6. Are follow-up visits with the dental assistant or with the dentist? This question is important because sometimes you just need to see your TMJ dentist. In my opinion, it's totally okay to have follow-up visits with the dental assistant. That's fine, as long as you're also getting FaceTime, maybe not at that visit, but another one, with the TMJ dentist. Those visits with the dentist are important because your dentist should be checking in with you to make sure you're feeling better. That is important. That's the whole reason you went there in the first place. If you have questions or if treatment is not going as planned, it's important to be able to speak with your TMJ dentist about that. But do please make sure that you're always kind to the dental assistant and to the entire team. Everybody is there to help you. Question number 7. How do you take payment and do you offer payment plans? I guess that's really 2 questions in one. The answer to this question will tell you how the payment system works at the practitioner in question's office. At my office, most people are in treatment anywhere from 7 to 9 months. So we break up payment over that time and sometimes even longer if needed. Remember that TMD treatment is not usually covered by medical insurance, even though it should be. TMD is a true medical problem that involves dysfunction of the muscles and the joints. It can be caused by the teeth and them not hitting correctly, yes, but it is a problem with the muscles and the joints. And that's why I believe it should be covered by medical insurance. Unfortunately, though, many times it's not. And that means that the financial responsibility falls entirely upon you. And having payment plans makes this much easier to handle and to manage. I do have 2 videos on insurance coverage and TMD with specific questions that you should be asking your insurance company if you call them. So I've linked those above and below. Do keep in mind, though, that whatever you're told over the phone is not a guarantee of coverage. Many people are told a lot of great things over the phone, but when it comes time to paying, the reimbursement is just not there. So keep that in mind. After asking all these questions and hearing the answers, you'll likely have a good idea of the experience level of your TMD practitioner and whether or not he or she is a good listener, if they're empathetic, if they're sympathetic, if they're compassionate. I do want to say that some of you might get a little frustrated because most of us dentists are not trained in treating TMD in dental school. So your search for a good TMD practitioner may be a long one. So again, I'm Dr. Priya Mistry, and I hope you found this information helpful. If so, please feel free to like, subscribe, and share with your family and friends. Check out my other socials. They are linked below. And for those of you with any questions, please sound off below. I still try to get back to everybody. It's just taking me a little bit longer these days. For those of you looking for TMD pain relief from the comfort of your own homes, please check out my free PDF guide called 3 Steps to TMJD Pain Relief. That is on my office website, which is also linked below. You go to the homepage and scroll all the way down. And remember, my friends, you can never have TMI about TMJ. Thank you.